So once you finish university, you have to do what we call a licensing exam, and that is with the College of Nurses of Ontario. And you have to pass that exam in order for you to get a license to practice as a nurse in Ontario. And if you practice without that license, then there is large fines that you would have to pay and charges. And also that you would probably never be able to get your license with the College of Nurses ever, because they're very strict. And the College of Nurses actually requires you to go through lots of restrictions on a yearly basis in order for you to maintain your license. And that's filling out an application, dealing with or doing your education on a yearly basis, and your quality assurance. Because the College of Nurses takes it very seriously that nurses are not going to harm the public, but they're there to help the public and assist the public with their healthcare needs, and they feel very strongly about that. And there is several nurses that have had their license pulled because of misconduct within their field of and their profession. Probably all of you have heard about that nurse down in the Woodstock area who had her license pulled and has been jailed because she was harmful to patients, and actually in several cases caused death with several patients. And so she will never be able to practice nursing again in Ontario, let alone in Canada, I believe, because of that case. And then there's been little misconducts as simple as just verbal abuse to patients and so forth, that people have had their license pulled because of those things, or on probation, and they've had to do some counseling and further education. So the College of Nurses does take it very seriously. And yes, you have to pass that exam once you finish your university in order for you to actually practice as a nurse. Some people do take some time off from actually doing their university program and to write the licensing exam. However, I probably would not recommend that, for the simple reason is that you're already in the school momentum, you're already in the school mind, the information that you've just learned is nice and fresh in your brain. And I think the further you wait from that, the harder the licensing exam could be. So I think it would probably be more feasible for you to complete it right off the bat, opposed to waiting. It does cost extra money for you to do that. When I did it, it was $100 and some odd. It's probably far more than that. And I think the other change too from when I wrote it, it was only for, I believe it was for Canada-wide, and I believe now if you write it, it is actually nationwide. So I believe the United States and Canada's exams are very similar. So if you were to actually write the exam, you would also be able to go down into the States and practice in the States as an RN as well, if that was something that you so desired as well. So I think that's just new within the last few years. So that, again, it opens up different fields. I've known a lot of nurses who have traveled to the States to do their nursing practice and get a ton of experiences down there, which I think is great. I don't really want to promote it because I think we need nurses up here just as equally as what they do down there, but sometimes the experiences can be far more exciting for people than they are here in Canada, for sure. So, yeah, both areas are good to work in. I think we might have a little bit more protection as nurses up here than maybe in the States as well. So that would be another reason why I would advocate for people to stay here. So the nurse practitioner program is anywhere from 2 to 3 years, depending if you do full-time or part-time, but there is four courses that you need. So one is roles and responsibility. The second one is pathophysiology, and both of those are still completely online, so you don't have to go to class for those. And then you had what we call AHAD, which is like assessed diagnostic something. I can't quite remember what the other two are, and therapeutics. And both of those courses are more in class. You have assignments and presentations and stuff, but along with that, as you're going to class 1 day a week, you are in clinical time for 2 days a week, basically. So, and that's where you are paired with a nurse practitioner that's experienced in the field, and you kind of do like a preceptorship with that individual. So, and then that's where you kind of learn what you're learning in class. You're also learning on the side as you're in clinical. There is lots of assignments, lots of reading that you have to do, and usually for AHEAD and therapeutics, you go through all of the systems. So week one will be like dermatology, which is all of your skin assessments, what to look for, and then therapeutics will back that up with the treatments for different rashes that you need and things like that. So that's kind of a rough of what the 4 courses are. And then you have what we call an integratium practicum, which is like a preceptorship. That's where you're actually with a nurse practitioner for 6 weeks, every day of the week. So you're shadowing that nurse practitioner at first, and then eventually you're worked up to where you're seeing patients solely on your own, and doing all of the stuff that the nurse practitioner would normally do in the office. Um, yes, you can advance as a nurse practitioner. You could definitely switch streams. So even though I'm in the primary care, I could switch to the acute care or adult stream, and it would mean going back to school to upgrade for that. Even though I'm in primary care, there's always a way of advancing your skills. So, for example, I'm doing the intrauterine devices, which is a form of birth control, and so I am doing the training on how to insert that to provide contraception method to young women, and treatment for women in menopausal years as well. There is, when I first started, I did not do punch biopsies. So I've actually increased my skills for that. So I do punch biopsies and suturing now. You could even advance that even further to where you're doing small excisions of lesions, or skin lesions, and doing suturing with those as well. So on an average day in our clinic, I can see a number of people. It's anywhere from the least I have seen in a day is 2. The most I've seen in a day is 17. So it depends on the type of day, depends on squeeze-ins. I'm basically in the office from anywhere from 8:30-ish to 9 to about 4:35. I have patients booked every half an hour during those office hours, with some extra admin time built into the day, as well as a lunch hour too. Some of my appointments are 45 minutes, some are 15 minutes long. The longest would be an hour, and those would be for the 18-month healthy toddler visit, as well as a well woman and a well male exam.